Let's talk about heart rate first. Heart rate has typically been the method of choice for aerobics because it's easy and a little more objective than the other two. AFA recommends taking heart rate at 3 different times during the workout. 5 minutes after beginning the active aerobic workout, that would be 5 minutes beyond the warm-up. At the completion of the most intense part of the workout, the top of the bell curve, and at the completion of the post-aerobic cool-down. Recovery heart rate, that taken after the post-aerobic cool-down, should not exceed 60% of a person's maximum heart rate. If it does, the student should be encouraged to keep moving until the heart rate drops. Let's review some rules about taking heart rate. You want to always have the students use their middle and index finger. The thumb has a pulse and can throw them off. The best positions for taking pulse are the radial artery in the wrist and the carotid artery in the neck. You can find the radial artery by putting your fingers on the bony knot in the wrist below the thumb and then sliding the fingers into the groove. The carotid artery is best found by placing the fingers on the Adam's apple and then sliding them to the right or left into the slight groove in your neck. Be careful not to press too hard at the neck. This can cause a pressor response, which can falsely elevate the heart rate. The count is taken for 10 seconds, starting with 1, and then the number is multiplied by 6 to get the beats per minute. There are numerous charts available to help students find their training level. More convenient are those that use the 10-second count number rather than having the student multiply it out. For those exercise enthusiasts that want to calculate their own target heart rate range, you can use the formulas in the AFA manual. The other two ways of monitoring intensity level are the talk test and perceived exertion. These are a little more subjective than the heart rate, so they often work better with experienced exercisers or in combination with the heart rate check. The talk test is simply the ability to carry on short bursts of conversation while exercising. If a person is so winded that they cannot talk while they're exercising, they're probably exercising too hard. The perceived exertion scale was developed by a scientist named Borg and is based on how a participant feels. The original scale was from 6 to 20, but has been revised to a 0 to 10 scale. It's best to use this scale in conjunction with the heart rate for beginners so that they can see a correlation between how they feel and their training heart rate. Also, when dealing with the elderly in particular, there are medications that may affect heart rate response during exercise, so perceived exertion may better reflect their intensity level. The last element of aerobic training is the duration of exercise necessary to elicit a training effect. Appropriate duration is largely dependent on the previous two elements of frequency and intensity. Duration and intensity in particular have a direct relationship. Lower intensity exercises must be performed for longer durations in order to achieve the same benefits. An example would be walking a mile versus jogging a mile. The aerobic benefit would be the same, however, it will take you longer to walk the mile. The American College of Sports Medicine recommends a minimum of 15 minutes, but optimally you need 20 to 30 minutes working within that target heart rate range to get the best benefit. The majority of aerobic gain possible can be made within 30 to 60 minutes of aerobic exercise. Beyond 60 minutes, the aerobic gain is incremental compared to the increased risk of overuse injuries. Now let's take a look at the physiological changes caused by aerobic training. Aerobic exercise affects change in the cardiovascular system in 3 major ways. Let's look at those. Getting oxygen to the blood, delivering oxygen to cells, and extracting oxygen from the blood. Let's look at each one in detail. Getting oxygen in the blood involves 2 things: ventilation, or breathing, and the oxygen carrying capacity of the blood. When you take in a breath, the lungs fill up like a balloon, and the amount of air taken in is called the tidal volume. With the onset of exercise, there comes an increase in tidal volume and respiratory rate. This overloads the respiratory muscles. The functional units of the lungs are the bronchioles, which are small passageways, and the alveoli, which are tiny sacs. It is within the thin walls of the alveoli that oxygen is passed into the blood and absorbed by the hemoglobin in the red blood cells. Hemoglobin is a protein molecule that carries the oxygen. The long-lasting effects of aerobic exercise are to increase, first, the strength of the intercostal muscles and diaphragm responsible for respiration, and to increase the hemoglobin content in the red blood cells so that more oxygen can be absorbed. The second factor is the delivery of oxygen to the cells. This is a function of the heart and blood vessels. As we discussed earlier, the heart is literally a muscle. It's made up of 3 layers of cardiac muscle tissue, but the one that does the primary work of the heart is called the myocardium. Blood is supplied to the myocardium via coronary arteries. The term myocardial infarction or heart attack is the result of a lack of blood flow to the myocardium. People who are aerobically fit reduce their risk for heart attack because aerobic exercise reduces blood cholesterol levels, responsible for causing the narrowing in the arteries, and because increased blood flow supplies more oxygen to the working heart muscle. In addition, studies have also shown aerobic exercise to be effective by increasing the production of the so-called good cholesterol, HDL cholesterol. It's responsible for clearing the arteries. Let's take a deeper look now at how the heart functions. The heart has 4 chambers. The 2 top chambers are called the atria, and the 2 lower chambers are called the ventricles. The 2 chambers on the right side of the heart take deoxygenated blood from the body and send it to the lungs to be oxygenated. Blood returns from the lungs to the left side of the heart, where again to the rest of the body. The left ventricle is significant because it is responsible for pumping the oxygenated blood out to the body. The amount of blood that the heart pumps with each beat is called its stroke volume, and the amount of blood that the heart can pump in 1 minute is referred to as the cardiac output. In persons who are aerobically fit, the strength of the left ventricle is increased, resulting in a larger stroke volume or ability to pump more blood with each beat of the heart. That's why people who are fit have lower resting heart rates. The third factor affected by aerobic exercise is the ability to extract oxygen from the blood at the cellular level. Aerobically trained muscle fibers have a greater ability to extract oxygen due to a higher concentration of what we call oxidative enzymes. Further, they have a greater ability to use the oxygen extracted because they have a larger number of mitochondria. Mitochondria are the functional parts of the cell that produce the aerobic energy. All these factors ultimately affect a person's oxygen consumption, that is, their delivery and utilization of oxygen, what we call their aerobic fitness.